Keonti Harpole, also known as Tiki, died April 8, 2020. She was 51. But for coronavirus, her husband says, she'd likely be with us today.
My wife was the picture of health, not sick, not ailing, nothing that we were fighting or dealing with. If not for that.
Tiki was in the first wave of coronavirus death in Maryland when testing was scarce and medicine unfamiliar with this new respiratory virus.
She went to the doctor, she went to the hospital. They said, oh, you got pneumonia. They gave her antibiotics and said, go home, come back in a week.
Her condition worsening. Adrienne Harpole took Tiki to the emergency room. She would never leave the hospital.
We donned masks and gloves and took her in the car, made her sit in the back seat, which I know was, painful, and took her to the emergency room. And we got her to the front door, and they said, that's as far as you can go. And that was pretty much goodbye at that point.
As of Friday, March 5th, 2021, 7,748 people have died in Maryland from coronavirus-related illness. 88% were 60 years or older. Based on 2019 statistics, coronavirus would be the third leading cause of death, behind heart disease and cancer.
But in the U.S., more than 500,000 people have died from the pandemic, and more than 28 million cases have been reported. And that's obviously an enormous tragedy, one of the worst public health disasters on record. And so I think when we take a step back and think about where we are and what we've all suffered over the last year, it's really striking.
Right now, new coronavirus cases in Maryland average 754 per day, a sharp drop from the 3,019 average cases per day in mid-January. At least 2 states this week lifted mask requirements. Maryland's restrictions, which vary among jurisdictions, have not substantially changed.
When is the right time to start easing restrictions?
Well, I think as case counts fall, we can start to think about how we can introduce more flexibility. Right now in Maryland, we have less than 1,000 cases a day, which is good news, but again, still a little bit high.
Keeps the food warm.
The economic impact of the pandemic has been harsh and may last several years. Donald Ross has been able to keep his catering business going only by pivoting to a meal delivery business.
Hey,
Hello.
right on time.
You'd be surprised how many people, single families, that are in need of cooked meals, healthy cooked meals, delivered to their homes on a daily basis. So I've been doing a 3-day, 4-day, and 5-day meal prep plan, which has just kind of taken off, and it kind of supplemented our income because all of my catering events have been canceled going into this year.
Donald's wife, Lakia, is also a small business owner. Like so many other retail and personal services businesses, she had to shut down last March. She reopened in May to limited capacity rules that continue.
You make enough to pay the bills, but we used to a normal rotation where you doing more than 8 people a day, when you doing up to 15 people. The income was cut drastically, but long as we still can work, I'm fine.
In December 2019, Maryland reported nearly 2.8 million jobs. In December 2020, the state reported about 2.6 million jobs, 124,700 jobs lost to the pandemic.
I was a medical auditor.
Amanda Edwards has been out of work for almost a full year. Like so many others, she's now battling with the state's unemployment system to collect benefits. Her next job uncertain.
It's just been a huge struggle. I don't know what to do. You know what I mean? Everybody says, go for assistance and help and all that stuff, but you can't get in touch with nobody. It's because everybody, I think, is trying to get help now with the economy, with everything going on.
The pandemic has exposed another layer of racial disparity. Black people make up 31% of the state's population. They represent 34.3% of COVID deaths. And the gap is wide in vaccinations. To date, 64.3% of people fully vaccinated in Maryland are white, 14.6% are black.
You try to look forward.
Adrienne Harpole, 11 months after the death of his wife, is now working on a campaign to urge black people to get vaccinated.
I've got a dozen friends who've lost their parents doing this. One of my very best friends is in Arkansas right now. His mother's funeral was yesterday. Another guy was working with me on this project. And in the midst of the project, his son died last Thursday. They buried him Saturday.
So what do the next few months look like? Dr. Rivers from the Johns Hopkins Center for Health Security told me she thinks case numbers will improve through the spring and summer. She's a little bit concerned about the fall due to the variants of the virus now circulating. I'm Jane Miller, WBAL TV 11 News.